Yeah, hello. This is a case from the South Asia. She has been operated before. What's the importance of this case? This is a surprise case. You can see you have seen too many noses, but it's different from all of them. Yeah, we see a huge bulbous tip and also an elevated dorsum that doesn't fit the South Asian prototype, but we do have a hanging columella. The alar show is not so fine. It's something that unsymmetric and it's not smooth. It's not going so sharp. The sides are not so nice in this case. But as I told before, there will be a great surprise. That we never mention it, that we never do it, we never advise it. Let's see, what's our plan? What shall we do? First of all, I'll see other pictures from different sides. Later on, we'll continue to tell the truth. Yeah, this is the view from the other side. It seems nice right here. We see the light line, but it's also below. There is an insufficiency of the nostril, and we do have hanging columella. It's so round. It's so round. The face is not so huge like this. Yeah, in this case, what we planned is the open rhinoplasty. This would be the revision rhinoplasty. So, what we encountered was so surprising. They put some silicone to increase the height and to reshape the dorsum. But that's not true, that's not perfect. We don't like it. Now you see the material, this is made of silicone. It's not enough so professional, it's just something different. There are irregularities right over there. And they implanted it. We don't prefer this method. In some patients, what thick skin and ethnic nose, they may not be problem, but this is so decreased in percentage. The main thing is that you cannot put something, another thing from a live tissue. The best tissue is our cartilage. We use generally septal cartilage for this reconstruction. If there isn't enough cartilage for the septal, for the cartilaginous septum, then we can have two other things. One is ear cartilage from the back side, and we can get also some rib cartilage. I prefer rib cartilage because it's too much and it's much more straight and it fits to the dorsal septum much more better. But in so restricted cases, we may use gamma irradiated cadaver cartilage also. But the best thing is the patient's own tissue. So, we don't like the silicone. It will go throughout the nose, even in any time of the life, because it makes pressure. It doesn't fit to the nose. That's the reason. So, it doesn't get also the best position. When you tilt it like this, it goes to left hand side, and you go there, it goes to right hand side. It won't stick, it won't hit your, it won't be a tissue. It's foreign body just. So, we can continue to talk. So, can you see the difference between two pictures? They are from both the same angles. Yeah, this was bulbous. There was a material right inside, which we take it off throughout the nose, and we implanted rib cartilage. We make it sharper, nice looking, well-defined tip. That's important. Also, we just cured this part. We made a alar support and we get it through back. The columella was not hanging anymore, so the nostrils will look better. The tip is so nice. The supra tip is the most prominent and the nicest part maybe, and it's much more smaller, cute, and the dorsal height is also retained, and according to me, it's a nice job, because ethnic nose means that It's a broad, wide, irregular, and lack of dorsum. So every problem seems to be solved in this operation. Yeah, it's a so fresh view. So you can see that when to one side there's an insufficiency of the nostril. So we supplied with cartilage, we make a nice triangle and symmetric, almost symmetric. Symmetry isn't everything for this operation. Nice looking nose is the best according to me, but it should be a little bit symmetric. A little bit, not too much. We don't have to exaggerate symmetry. But you see that every nostril is supported and strong enough. She can breathe well now. And also there is a nice columella, doesn't bend to one side, so it's a nice view from bottom. There won't be any scar, the tissues will retract later on, and it will be so nice. This is the oblique view of the preoperative and postoperative views. Yeah, you see the prominent tip, prominent supratip, nice dorsum, narrow nose, and also nice looking nostrils and the columella. And even if the shape of the lip and nose position changed a little bit, so it's a cute nose. It's so nice according to me. And my patient is also so happy with this result. So, what the important thing is that you should know what the patient wants. So you should talk with the patient, and you should plan the operation so thoroughly, so nice, so deep, and so clear. And the result will be so nice. The experience is important, but the surgeon should know what to plan, what to do inside the operation. So there won't be any rejection of the graft material because it's her own tissue. So everything will be nice. You see a little dot right here. It's a nice lesion, but it can make a broad, wide lesion scar. So after all, it will fade away, it will go through away. There won't be any other fistula or something like this. The lesions will be going and fading away. The nose will look better and natural. So, as my patient is happy, I'm happy too.